Let's talk a little bit about some of the common diseases that we see in the eye clinic. Even though it seems like a wild and varying number of different conditions, it's actually a relatively small number of things that we see. Most commonly, we see a lot of patients with age-related macular degeneration. These really break down into two different forms. The most common in the population is dry age-related macular degeneration, which we think is a inability of the retina and retinal pigment epithelium to process wastes adequately. That means that this material accumulates underneath the retina, which we call drusen. And those drusen are little bumps that we see, typically yellow colored, underneath the retina, and they'll grow there over time. Sometimes they're small and sometimes they're large. It is thought that the drusen will then poison the cells around them, and you'll get a breakdown of cells. And I call that pigment migration. You see little black clumps in the retinal pigment epithelium. Over time, then, that changes in the retinal pigment epithelium can cause loss of those cells, which we see as blank spots in the retina or retinal pigment epithelium, and we call that geographic atrophy. In areas with geographic atrophy, you'll have no vision, it will be blank. Now, some people can start developing new blood vessels underneath the retina, coming from the layers deep to the retinal pigment epithelium, the layer that's called the choroid. Out of that layer can grow these vessels. They can grow underneath the retinal pigment epithelium or on top of, and that can cause fluid and scar tissue to form underneath the retina, and this constitutes wet macular degeneration. Even though these are about 10% of the total macular degeneration cases, they're the overwhelming number that we see in clinic because we can treat this. Dry age-related macular degeneration is more common, but frequently does not require or does not benefit from treatments, so we in this clinic tend to see it less often. These are one of the main conditions where we do our treatments, which are injections of medication inside the eye itself, so intravitreal injection. These injections are injections of an anti-growth factor agent. The growth factor is called vascular endothelial growth factor, and it seems to convey two different properties in the eye. The vascular endothelial growth factor can cause new blood vessels to grow, especially in places we don't want them to, and can cause them to leak. So new blood vessels can grow underneath the retina in this case, blocking the retina away from its food source, which is the retinal pigment epithelium, or it can cause fluid leakage underneath the retina, which we'll see as pockets of fluid underneath there. When we treat with anti-vascular endothelial growth factor drugs, then the blood vessels will shrink down. They will not disappear, and they do not totally inactivate as a result of our therapies, but it can improve vision very significantly. The vision improvements are directly the result of the reduction of edema. People who have decreased vision with age-related macular degeneration then will have decreased vision because of fibrosis underneath the retina or various other different parts of the macular degeneration. Anti-vascular endothelial growth factor drugs we'll talk about more extensively in the future, but they go by the name brands of Avastin, Lucentis, Eylea, Vabysmo, and we use all of those pretty frequently.